This video has a little controversial title. It is 5 nursing school mistakes that you might be making. And nursing school is stressful enough. I don't make this video to make you more stressed, but almost to give you a little bit more comfort. So if you haven't met me yet, hello, I'm Nurse Meg from nursemegrn.com. I create resources and courses and anything I can create to make your life easier and make your nursing journey easier. I'm here to help you from every step of the way, from getting into school, passing the T's and other entry exams, surviving nursing school, studying and passing the NCLEX the easiest way possible, and then supporting you in your first couple years as a nurse so you get the best foundation and you're confident in your skills. So this one is directed specifically to nursing students, and these are 5 mistakes that you might be making. Let's get into it. Number 1 is caring too much about care plans and putting all of your effort into care plans. I promise you, when you graduate, you will never see another care plan. I don't use care plans. You don't use care plans to take care of patients. Some Cerner, which is a EMR, they like to add care plans, and it's like this silly thing as part of the chart, but when it comes to caring for the patient, you will not be formulating care plans as you do in school. It's sort of okay to start to become a detective and start to see the patient as like something you need to investigate and symptoms you need to investigate and anticipating what they may be at risk for. But honestly, do it to pass. I promise you, do not put all of your stake and worth and time and mental energy into care plans. Just pass. Number 2 is overstudying. Yes, it is possible to overstudy. Your brain is a muscle, your brain is an organ, and you can overuse it. If you are studying for more than 2 hours in one setting, your brain is shutting off and not receiving the information. You need to be creating effective study environments, and for some people that is in the comfort of their home. Some people it is in a public place like a library or a coffee shop. Some people need to drown everything out, so they wear noise canceling headphones. Find what works for you, create that environment. Always have a little bit of snacks and water there so that you're not like deprived, that your brain is in a good place. And then study for 2 hours is the max for one sitting. Otherwise your brain shuts off and you're not retaining the information. You want to study effectively and not frivolously. You don't want to study for 5 hours. Are you really getting everything? You're not. Another thing regarding studying is test anxiety. You gotta handle your test anxiety. You gotta start to conquer that test anxiety and control your brain and not let your brain control you. I know people who are super smart, who know all the content, and when it comes to taking the test, they black out and forget everything. Don't let your brain and your body run you. You run your brain. You run your body. So start doing exercises like when you're studying, smile, do a meditation before you study, learn the 4 square breathing exercises, whatever you can do. I have a ton of TikToks on this topic, and start to control your anxiety as you are studying. When you're sitting for an exam, take a break every 5 questions, do some breathing exercises. Handle your test anxiety early in nursing school. This will also help you when you're studying for the NCLEX. Number 4 is not taking full advantage of your clinicals. This could be a huge, huge mistake. I know sometimes you are assigned a patient and assigned a nurse, and sometimes the patient doesn't want you and the nurse doesn't want you. I'm so sorry. You need to find the nurse Meg of that floor and follow them around for the entire shift as much as you can, okay? So sometimes what you're assigned, you need to kind of put it to the side, maybe do whatever required paperwork you need to, but find the nurse that wants to teach and just follow them around and hang out with them. I know it's difficult, but there's gotta be at least one on every floor, okay guys? Find that one and just follow them around. Take advantage of your clinical time. You always want to be talking to people, making friends, getting phone numbers, getting emails, seeing if that's kind of the floor for you, seeing if it's like the department that you would feel comfortable with, meet the charge nurses, meet the managers, whoever you can. Take advantage of clinical time. Now that brings me into the final mistake, applying too late to jobs. You don't have to wait until you're graduated, passing the NCLEX with a license to apply to a job. You can apply in your last couple semesters. You should be like networking and seeing which hospitals you want to work at, emailing back and forth. Apply to jobs without your license. Find your way in. You have to be vocal and you have to be asking, especially on floors that don't have a high turnover rate. Like if you want to be working OB or you want to work in the NICU or pre-op, there are places where people love to do it and they stay there, and so there's not a lot of open positions sometimes. So find where you want to work and do your networking and apply early. Don't wait until you have your license and everything's all set. You can apply early and interview early, I promise, okay? We do it all the time. So those are the 5 mistakes that you could be making in nursing school. None of these are meant to discourage you. Like I said, they're all meant to encourage you. So I hope that you got something valuable out of this video. If you did, let me know down below in the comments, and I will see you on my next video or on TikTok.